Hi, my name is Angela Alsbrook. I'm a nurse practitioner student at the University of Memphis, and I will be doing your head-to-toe assessment today. Throughout the assessment, I will be observing your skin for color, texture, moisture, excessive dryness, moles, wounds, anything of that sort. So to start, I'm going to inspect your hair for texture, distribution, lesions, infestations. Everything's good there. All right, so the next thing I'm going to do is I'm going to palpate your carotid arteries. Any tenderness when I do that?
No.
Good, okay. I'm going to palpate your TMJ joint, noted any crepitus or subluxation, nothing noted there. So the next thing, I'm going to palpate your trachea, which is midline. And then I'm going to feel for your thyroid. Can you swallow for me? Good. And then I'm going to palpate your maxillary and frontal sinuses. Is there any pain when I do that?
No.
Okay. Your ears are symmetric, no crustaceans, there's no lesions, and nothing obviously wrong with your tragus or your pinna. So then I'm going to move on to your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Okay, so now we're going to move on to your cranial nerves. So cranial nerve 2 is testing your visual acuity. So if you would just read this top line on this for me.
EJRSOP.
Okay, and cover one of your eyes and read the second line.
BLNLAC.
All right, and then cover your switch eyes and then read the next line.
FRSLMU.
Good. All right, so now we're going to check your peripheral vision. So I'm going to hold up my fingers. Tell me when you can see them and how many fingers I'm holding.
2.
Okay. Keep your eyes straight though.
1.
Okay, good. So cranial nerve 3, 4, and 6. I'm going to check your pupils. So I'm going to shine a bright light in your eyes. Just look straight for me, okay? Pupils equal, round, and reactive to light. And I'm just going to bring this in towards your nose. I'm not going to touch you, but just follow it with just your eyes. Good. And accommodation. So let's test your 6 cardinal fields of gaze. Just follow this with your eyes. Keep your head straight, okay? Good. All right, and so I'm going to switch this around so that I can check for your red reflex in your eyes. So if you would just look forward for me, and I'm going to shine a light in your eyes once more. Okay, red reflex is present, conjunctiva is clear, no dryness or excessive tearing noted out of the eyes. So the next thing is cranial nerve 5. I'm going to check the strength of your masseter muscle. So if you'll just clench your jaw for me. Good. All right, so now I want you to close your eyes and tell me when you can feel this cotton swab on your face, okay?
No.
Good. Cranial nerve 7, I'm going to test your facial expression. So puff out your cheeks. All right, good. Smile for me. Close your eyes tight and raise your eyebrows. Good. So cranial nerve 8 is the hearing test. So we're going to go through a couple of different things. First thing I'm going to do is I'm going to put this tuning fork on your head, performing the Weber test, checking for lateralization. So when I place this on your head, just let me know whether or not you can hear it equally in both ears.
Yes.
Okay. And now we're going to do the Renee test, where I'm going to place this on the back of your ear. You tell me when you no longer hear it. And I'm going to put it in the front of your ear. Tell me when you no longer hear it. We're going to do that on both sides.
No. Yes.
Okay, so air conduction is longer than bone conduction. So we're gonna do the whisper test. So I'm gonna whisper 2 words on this side. I want you to tell me what you hear and we'll repeat it on that side.
Apple, banana,
Okay,
fall back.
okay, good. So now I'm gonna look in your ears at your tympanic membranes. Tympanic membranes are pearly gray, translucent, and all prominent structures noted bilaterally in both ears. So let's see. So 9, 10, and 12, I gotta look in your mouth now. So I'm gonna shine a light in your mouth and you just say ah for me, okay?
Ah.
All right, uvula rise is midline and symmetric. Oral mucosa is pink, moist, no lesions, no loose or decaying teeth noted. Last cranial nerve, I want you to shrug your shoulders against my resistance. Good. Cranial nerve 11 is intact. So now we're going to move on to, let's check your range of motion in your neck. So your neck is extended, so flex your head forward. Good. Bring it back to extension. Hyperextend it backwards. Bring it back to extension. Let's test rotation. So bring your chin to your shoulder. And the other way. Good. And then we're going to check lateral flexion. So try and bring your ear to your shoulders. Good. Okay. So now if you'll just breathe normally, I'm just going to watch you breathe. Noting the rise and fall of your chest, which is equal, symmetric. You're not labored. So I'm going to go back here and I'm going to test the expansion of your chest. I'm going to squeeze a little bit and have you take a deep breath. Good. Expansion is equal. So while we're back here also, I'm going to test your costovertebral angle tenderness. I'm going to hit my fist and let me know if it hurts, okay? All right, so moving back to your lungs, I'm going to place my hands on your back and I want you to say 99, okay? So every time you feel me place my hands on your back, just say 99.
99, 99, 99.
Good. All right, so now I'm going to percuss, so you're going to feel me thump various places around your back. I'm going to do this in over 10 points. And I'm going to do the same thing laterally, checking 2 points. Good. So now I'm going to listen on those same 10 points posteriorly. Laterally. And I'm going to come around and listen anteriorly. Good. Okay, so now we're going to move to your cardiac cycle. I'm just going to palpate your carotid arteries. And now I'm going to listen to your carotid arteries for any bruise. Can you hold your breath? Good. Now you can breathe normally, and I'm going to listen to your heart. I'm going to go through the 5 anatomical locations: aortic, pulmonic, Erb's point, tricuspid, and mitral valve, which is the point of maximum impulse. And normally I would listen to that for a full minute, but due to time constraints, we're just going to say I did it. So if you would lay down for me now. I'm going to listen to those same locations with you laying down with my diaphragm and my bell. Okay, and while we're laying down, I'm going to listen to some of the arteries in your stomach with the bell. I'm going to listen to your aortic, your iliac, your renal, and your femoral arteries. No bruits noted. And now I'm going to listen to your bowel sounds, starting in the right lower quadrant, moving up to the right upper quadrant, left upper quadrant, left lower quadrant. Okay, almost done laying down. So now I'm going to percuss your abdomen. Tympani noted. And now I'm going to palpate, noting any masses or tenderness. And I'm going to try and feel the tail of your liver and your spleen. Good. Okay, now we can sit back up. Okay, so squeeze my fingers for me. Good. Hand strength is good. Radial pulses are 2+. Capillary refill in your fingers are good. So now I'm going to test steretogenesis. I'm going to place an object in your hand and I want you to tell me what it is.
Bobby pin.
Okay. And now we're going to do graphophagia, where I'm going to draw a number or a letter in your hand and I want you to tell me what I'm drawing.
3.
Good. All right, so you can open your eyes and we're going to test the strength and the movement in your hands and your wrists. So extend your hands, flex your fingers, bring them back out. Now I want you to take each fingertip to your thumb. Good. Put your hands in neutral. Hyperextend your wrists, flex your wrists. Good. Ulnar fixate, flexion, bring it back to neutral. Radial flexion, good, and then just rotate your wrist all the way around one time for me. Good. So let's test your cerebellar coordination. I want you to take your hands and I want you to flop them back and forth on your thighs. Good. And now I want you to touch your finger to my finger and then your nose and bring it back to my finger regardless of where my finger is, okay? Good. All right, so now we're going to test the strength and the flexion in your elbows. So put your elbows out to normal extension, flex them up for me. Good. Don't let me push, don't let me pull. Good. So let's try your shoulders. So extend your shoulders out, hyperextend them behind your neck and bring them back and flex them behind your back. Bring them back out for me one more time. Don't let me push, don't let me pull. Good. All right, so we're almost ready to stand up, but I got a couple more things. I'm going to check your pulses in your feet. Dorsalis, pedis, posterior tibial, capillary refill in your toes are good. Can you push against my hands? Good. And pull your toes towards your nose. Awesome. We're going to check the strength in your knees, so don't let me push, don't let me pull. All right, so let's go ahead and stand up. All right, so we're going to check the range of motion in your spine in just a second, but I want you to stand still for just a second just to make sure that there's not any swaying or anything. All right, so bend forward for me. While you're bending forward, I'm going to check your spine for any deformity, no scoliosis or bulging noted, so you can stand up. All right, so flex to your right, your hip, flex to your left, and then try to hyperextend backwards. All right, so take a couple of steps out for me. I want you to just walk towards this wall normally, and when you get there, turn back around. Good. Okay, so on the way back, I want you to take steps, one foot directly in front of the other. After you take about 3 or 4, close your eyes and repeat that. Okay, so hop on one foot and then switch to the other foot. Okay. I'm gonna take a minute and make sure I didn't forget anything, which I know I probably have. So, cranial nerves, listen to you. And check your jugular vein distension. Sit back down and lay down for me. All right, so turn your head to the side. All right, no jugular vein distension or pulsations noted that way. And if you'll turn back towards me, good. I'm gonna leave you laying like this for a second just to make sure that I got everything. Let's see. Can you bring your knee up like this? Good. Bring it out to the side. Bend it over. We're gonna do that on the other side, okay? So bring it up. Bring it towards me. And then bring it out to the side. Okay, I can't think of anything else that I need to do. What's the time?
16.
Just pause it.